This is Jerry Hesch from the Hesch Institute in Aurora, Colorado, and my client Jenna flew in from Mesa, Arizona for me to treat her thoracic spine and her sacroiliac. On the first day, now her injury goes back 7 years?
Yes.
Okay. And we looked through your medical file, and you spent how much out of pocket over the years?
Oh my goodness, thousands, with numerous PTs, orthopedic specialists, massage. Oh my gosh, you name it, I've been there, done that.
Chiropractic?
Thousands of dollars, yes. Several chiropractors.
Yeah. So yesterday, the way she presented is with what we call an anterior ilium. And that is when the right side of the pelvis presents as being anterior and inferior in relationship to the left. Now, some people claim that's rotation of the ilium on the sacrum, but the motion is only 2 degrees in that joint. Further to that, the pube is a distance enough away, the pubic joint is a distance enough from the SI joint that there would be a discernible rotation in the pubic joint, but her pubic joint was symmetrical all the way down and at the top. So it was a function of the whole pelvis being twisted on the hip joints, but being kept that way by the nervous system. She had blocked posterior rotation mobility, and we treated it, and then I taught her self-treatment. You can look up anterior ilium on YouTube and type my name, H-E-S like Sam, C-H, and you can see the self-treatment. We treated it and we restored normal mobility. So today she comes back with normal mobility. Noteworthy is that it still is somewhat lower. The ASIS, anterior superior iliac spine of the ilium, is still a little bit forward and a little bit inferior in relationship to the left. But we have normal movement. Okay, now let's have you lie on your stomach. Now you would ask, does she have a posterior rotation on the opposite side? And because I can take up the slack and I can induce spring mobility through the joint on the left, and that is not the case. Now yesterday she also had a left twist in the transverse plane, which is named right in flare, left out flare, and she had blocked mobility when we did a spring on the ilium laterally, but today that's restored. You were much improved. You greeted me with a hug this morning.
Oh, yes, absolutely.
So tell me how you felt in response to that treatment. But the other thing we did was we also restored movement in ribs number 10 and 11. And you've had that thoracic pain, and no one looked at it. No. In 7 years. No one attempted to help that.
No, that's correct.
Okay, so how did you feel in response to yesterday's treatment?
I felt incredible. I felt like I can move again. I felt like I can walk straight. I was not resistant as far as trying to sit or just, live a normal life and normal functions. So I was able to move my body the way I used to 7 years ago.
And you said the most interesting thing. When I was done treating you, restoring movement in the pelvis and in the 10th and 11th rib on the right, you walked down the hall and back and you said, my arms feel like they have better blood flow.
Yes, I had goosebumps in my arms because I haven't had feeling like that for years.
Amazing. I have no way of correlating. I would never tell someone that if I restore this movement in the ribs and in the pelvis that they're going to have better circulation in their arms. They're going to feel that. It's such a unique response, but the body's connected. It's a functional whole, and the nervous system is mysterious. So that's just really a very interesting response. Then I found an oblique restriction of the occipito-atlantal joint, the first joint where the head connects to the first vertebrae. And you can also look that up on YouTube using my last name, Hesch, H-E-S-C-H, and occipito-atlantal joint, O-C-C-I-P-T-O-A-T-L-A-N-T-A-L, or just type occiput Hesch. We treated that, and then you felt goosebumps on your head, right?
Yes, full mobility, range of motion in my head.
Yeah, neck.
To both sides.
Yep. So that was an interesting finding, and I predicted that today you might come back with a different pattern. And that's the secret that a lot of people don't know. Unfortunately, our medical model is based on doing the diagnosis on the first visit, and then directing all future visits to addressing that same diagnosis. But I know through experience that the pelvis undergoes permutations. I didn't see this other pattern yesterday, but you walked a lot, you went out to eat, you went to a couple of bars to watch the baseball, and you know, you put forces through that structure.
Sure.
And then you come back today and another pattern emerges. And this is called a lower windswept pelvis. And I've got lots of video on YouTube on that. And basically, the lower pelvis side bends to the left. There's also a rotational component to the left. So the left sit bone, the ischium, is forward. I'm sorry, it's backwards towards the ceiling. It's higher on the left than on the right. This sometimes accompanies a lower pubic rotation, but you don't have that. It oftentimes accompanies a side bent tailbone. You don't have that. But what you do have, and I'm going to change the camera angle, you have a more medial right sit bone. So your clothing matches the midline crease of your body, okay? So I'm on the inside of the right sit bone, the ischium, and there's about a thumb width space between it and your gluteal crease. On the left side, there are at least 2 thumb widths between the ischium and the gluteal crease. But it's more important, some people have a pelvis that is developed asymmetrically, so it's not about how it looks, okay? I treat movement dysfunction, and what we have is an inability to take up the slacks, springing the left ischium medially, and the same is found on the right side. I cannot spring it outward, and then I cannot spring the right one medially with a reasonable amount of force, and then the same is true on the left side. I cannot spring it laterally, and we'll show how that changes with treatment. You'll be able to see how it's easy to take a movement to a stop point and then spring it and get additional movement. Now, the body compensates. There's a reflex in your body that if you have an asymmetry in the lower body that's aberrant from your normal postural schema, it will move the upper body in the opposite direction. Now, I don't think the camera is going to capture this subtle movement, but I'm going to go ahead and have you lay on your back and then bring your head up. Okay, lift your head. Alrighty, and down. And so I'm going to capture the back of your head and face, okay? Mm-hmm. And I think what I'll do is demonstrate with the skull model what I'm doing. So I'm looking for where she compensates, and I looked at upper cervical rotation, lifting up at C1, and then I did a posterior spring on the mastoid on both sides to see if there's a restriction in the OA joint, occiput atlas joint. And now what I'm doing is I'm doing a lateral shear to the left, and then I'm shearing it to the right, okay? Going with a small amount of force, so we're isolating the upper joints in the neck, and I can shear you over to the left, and then I can spring it and get additional movement. When I shear you to the right, it hits an end point quickly. And then when I try with additional force to shear you to the right, there's no movement. What I predict is that by restoring normal lower pelvic movement, that this pattern in the upper neck will just go away. So I'm done filming now. There's other videos where I show the treatment for a lower windswept pelvis, so I'm not going to cover that in this video. But I'll stop filming now. Thank you.